You clicked on this video because you're wondering, is shockwave therapy actually safe? Maybe you're considering it for your pain or someone recommended it, but you're unsure about the risks, side effects, and whether it's really worth it. Well, you're in the right place because in this video, I'm going to answer all of those questions and break it down for you in simple terms. We'll cover what shockwave therapy is and how it works, the common side effects you might experience, who should avoid it and why, and what you can do to make it even safer and more effective. Plus, stay with me until the end because I'll share the one mistake people make that turns a safe treatment into a waste of time and how to avoid it. If you're over 50 and want to stay pain-free, mobile and strong without relying on surgery or painkillers, subscribe to the 10x Physio channel now and turn on the notifications. We're here to give you expert tips, insights and strategies to help you live a healthier life on your own terms. Hi there, I'm Gavin Noble from Gav Noble Physiotherapy in Lisburn, and this is the 10x Physio channel where we give you all the top tips and tricks to lead a healthier life. We specialise in helping people aged 50 and above stay pain-free, mobile and strong so they can avoid the doctor's office and get back to doing what they love. And that includes giving you real answers to important questions like whether shockwave therapy is truly safe. So let's start with what shockwave therapy actually is. Shockwave therapy is a non-invasive treatment that uses high energy sound waves to stimulate healing in your tissues. We use a handheld device to send these waves through the skin into the painful area. This kickstarts your body's natural healing process by increasing blood flow, breaking down scar tissue, and encouraging new cell growth in tendons, ligaments, and fascia. There's no needles, no surgery, no medication. It's been used for decades around the world, and it's backed by clinical research for a variety of conditions like plantar fasciitis, Achilles tendinopathy, shoulder calcifications, and tennis elbow. Now, let's get straight to the point. Yes, shockwave therapy is generally very safe. It's non-invasive, which means there's no cutting, no anaesthetic, and no injections involved. It's even safe for older adults, those with joint replacements in other areas, and people who can't tolerate other more invasive treatments. The key thing to know is that shockwave works by causing controlled microtrauma. This means your body senses a mild stress in the area and responds by healing. That sounds intense, but it's very targeted, short-lived, and well tolerated by most people, especially when done by an experienced therapist like what we have here at Gav Noble Physiotherapy. Have you ever been told you might need shockwave therapy? Or are you considering it but still have questions? Leave a comment below and let me know what you're wondering, or get in touch directly with us here at Gav Noble Physiotherapy for a free phone consultation. We'd be happy to help you work out whether this is the right option for you. And remember, stick around because in a few minutes I'm going to share the most common mistake people make after shockwave therapy that stops them from getting the full results. You don't want to miss it. Now, like any treatment, shockwave therapy can have side effects, but they're usually very mild and temporary. The most common ones include mild redness or swelling in the treated area, sometimes very slight bruising, some tenderness for a day or two after the session. Some people often describe it like a worked muscle feeling, and that's actually a good sign that your body is responding. We always talk you through what to expect and we adjust the intensity based on your tolerance so you can stay comfortable throughout the process. Now, here's when shockwave might not be right for you. If you have a blood clotting disorder, an active infection in the treatment area, a tumour or cancer in the area, or you're pregnant and the treatment area is near the pelvis, then we won't use shockwave therapy, at least not until it's safe to do so. This is why we always do a full assessment before we recommend the treatment to make sure it's safe and appropriate for your specific health background. Here's the good news. You can make shockwave therapy even safer and more effective by doing just a few simple things. Make sure it's delivered by a qualified therapist. Don't ice or take anti-inflammatories right after. It can interrupt the healing process. Follow the aftercare advice we give you, including the mobility and strengthening exercises. Don't overdo activity in the days following treatment. Let the area settle and respond. Think of it as working with your body, not against it. When you combine shockwave therapy with smart movement and recovery, that's where the real magic happens. And now for the big one, the biggest mistake people make after shockwave therapy. They stop too soon. They have 1 or 2 sessions, feel a little bit better, and decide to quit, thinking the job's done. But shockwave therapy is most effective as part of a course, usually between 6 to 8 sessions, depending on your condition. And the healing often continues after the treatment finishes. So be patient, stick with it, trust the process. When done correctly, it's one of the safest and most effective tools we have. If you want to know exactly how shockwave therapy works, you can click on another video here, which is how shockwave therapy works, healing pain without injections or surgery. And if you're ready to talk to someone, give us a ring here at Gav Noble Physiotherapy, or visit our website to book your free discovery consultation. I'm Gavin Noble from the 10X Physio channel, helping you stay strong, mobile, and out of the doctor's office. I'll see you in the next video.